influence the progression of the nursing and the development of the nursing profession. So changing of demographic, that would be all the baby boomers and aging of the population. Lots of technological advances. So as we have more and more computers at the bedside, then the nurse, the registered nurse, actually gets further and further from the bedside, and we have other healthcare personnel who is helping to take care of the patients. We have very educated consumers that come to not just to nurses but to physicians as well, and they tell you what they want you to do. So we really need to help navigate the information they get with the information that we know. Increased complexity in patient care, so the projections are that people in the hospital, so it's going to be sicker and sicker people in the hospital, so it's very complex. Shift to home and community care. So the thought is that only the sickest of the sick will remain in the hospitals, and there will be shifting into, and you'll see this in the business projection. Cost of healthcare, that's not new to anybody. Impact of healthcare and policy, and I'll give you an example for that one. There is a growing need for interdisciplinary education. We need to work as a team. It is much more important now as we try to protect the patient while we're taking care of the patient. So it's very important that all the pieces on the healthcare team work together. Impending nursing shortage, and then significant advances in research and nursing science. So here are some of the examples. So when the rule came out that medical residents could not work so many hours because they really worked ungodly hours. I never knew how they could function without sleep. So now that it has shortened in the last several years, hospitals have many more acute care nurse practitioners who now are there taking care of the patients while the residents get their break in between their shifts. There is greater acuity in hospitals, so many individuals are really discharged to subacute and rehab facilities. And what that means is, well, before, many of the subacute and rehab facilities had maybe one or two RNs, registered nurses, and then a lot of LPNs and nursing aides to take care of patients. Now, as we move more sicker individuals into subacute and rehab with a lot of morbidities, maybe high blood pressure and diabetes and some cardiac issues and things like this, you really need highly skilled professionals to take care of individuals. Shortage of nurses, so that has caused throughout the years, we have something called medication techs. They're not professional nurses, they're individuals that we teach about medication and they pass medication. It's not ideal, but this is just a result of what has happened and how policymakers and other influential individuals have come up with solutions. And so also patient care assistants as well. They do some of the nursing function, some of the things at the bedside, and they typically work as a team with a registered nurse, or maybe it's an aide, an LPN, and a registered nurse. Obamacare projection is that 30 plus million people will need care. Nurse practitioners, typically more of them serve in rural areas than physicians do. And magnet certification. So magnet certification in the hospital has become a very prestigious certification. They found out so many years ago, maybe 10, maybe more, that there were certain hospitals that nurses were attracted to, and so they looked at the characteristic of what are these characteristics of these hospitals. They were called magnet hospitals, and there was a commission that developed the criteria, and now hospitals try to meet the criteria to become a magnet hospital, because then the really good nurses go there. So one of the criteria is that 80% of the workforce will be BSN nurses, registered nurses. So they try to phase out the LPNs. They ask them to go and get their BSN degree. And in some areas, they do not hire associate degree nurses anymore.